Hello everyone, this is Talk in DC. I'm Jason. 嗨，大家好，这里是华府论坛，我是 Jason. On March 25th, my friend Tony made some suggestions about COVID-19 epidemic trends. I was hesitating to talk about it because I do not want to scare everybody. I don't want to make everybody feel horrible about his suggestions. Now today, a lot of things has been proved to be true. So I'm going to talk about his suggestions and some of his predictions about COVID-19 epidemic trends. On March 25th, my friend Tony said, "Note the growth of confirmed cases and death tolls are rising at an exponential rate, especially in the United States. Since I did the update last time, on March 23rd, we have witnessed an increase of 26,040 cases in only 2 days, or equivalent to having a new virus-infected patient in every 6.6 seconds in the last 48 hours, and added more than 500 deaths in the same period. There is no doubt that US is destined to surpass Italy and China and become the most severely infected nation on this planet in just a few days." And this suggestion has been proved to be true on March 27th. On March 25th, my friend Tony said another scary thing. It took 44 days, January 23rd through March 6th, for the world to reach its first 100K cases. It took much shorter, 11 days, March 6th through March 17th, for the world to reach 200K. And then only 4 days, March 17th through March 21st, to reach 300K. Then barely 3 days, March 21st through March 24th, to reach 400K. We are at 471K now and on a path of reaching 500K in just 2 days, March 24th through March 26th. Anything beyond that is everyone's guess. We are really dealing with a new pandemic of epic proportion. And this scary thing has been proved to be true too. On March 25th, my friend Tony concluded that, "I know we will eventually beat this devil and get normality back in our lives, but how long? And how big are the collateral damages, such as stock crash, which occurred already, unemployment, social unrest, chaos, etc." Oh well, enough said. On April 1st, a health research center at the University of Washington School of Medicine believes the coronavirus will be devastating in the US. Their research study is posted on the URL. I hope it is an overestimate. The charts below show projected hospital resource used based on COVID-19 deaths. They projected 2,271 COVID-19 deaths per day on April 15. They concluded total 84,141 COVID-19 deaths projected to August 4, 2020 in United States of America. After reading the research study, the first source from my friend Tony, he said, a very interesting study. University of Washington's medical school is rated as a top 10 medical school in the country. So the prediction they made has its bearings and credentials. So here are my friend Tony's observations from this research study. 1. It predicted the total death toll in the U.S. will hit 82,141 cases by August 4th, 2020. Using this figure and apply the current mortality rate, I came up with an equivalent of 4.7 million plus U.S. citizens be infected during the pandemic. If the study's upper range death toll roughly at 120,000 fatalities turns out to be more realistic, then the total infected would be close to 7 million. Second, the pandemic should peak in mid-April, April 15, 2020, in the U.S., or about a little over 2 weeks from today, by which time U.S. will need a total of 224,000 plus hospital beds. Upper range is 350,000 plus beds needed, and face a hospital bed shortage of 61,000 plus, of which 15,000 plus are ICU beds. We also require about 27,000 ventilators at the time. Third, our daily deaths would reach 2,271 by mid-April, April 15, 2020, and could be as many as 3.5K at the high side. Fourth, luckily, since in Maryland and Virginia fared a little bit better. In Maryland, it predicts total death tolls to be 1,171 with an upper range of 3.5K plus. Virginia's total fatalities would be 2,053 with upper limit at about 7K. Fifth, both MD and VA has enough hospital beds to house their infected patients, with a small amount of shortage in ICU beds by the peak of pandemic. MD needs 78 additional ICU beds, whereas VA requires 223 more ICU beds. MD and VA need a relatively smaller amount of ventilators, predicted at 78 and 275 respectively for them. 6. With 4.7 million to 7 million folks in the U.S. to be infected by the prediction, we are now barely at the very beginning stage of this pandemic. But then again, MD and VA would face a lesser devastating scenario. Seventh, from the press conference conducted by the White House and the U.S. Coronavirus Task Force, it appears a more thorough study is in place and will be made public by Tuesday, March 31st, 2020, with every indication hint a more severe scenario. This is likely the reason behind President Trump's decision to extend the social distance guideline by another 30 days to April 30th, 2020. 8th, while I'm eagerly to peek into the official study tomorrow, March 31st, 2020, before that becomes a reality, I think this one made by University of Washington has its merits and worth every minute of reading. My friend Tony concluded that don't be too optimistic. We are far from in control or out of the epidemic. Yes, although the report is scary, it is indeed a mathematical model estimated from existing data, and the accuracy is still there. Hope to reach the peak early and end early. Now, let's look at the number changes in these epidemic trends. On March 31st, 2020, United States has 188 and 918 confirmed cases, and globally we have 858,854 confirmed cases globally, almost 1 million. New York is the most severely infected state in the United States. It has 75,963 confirmed cases. We can see that globally, United States has the most number of confirmed cases, followed by Italy, and then followed by Spain. Mainland China has dropped to the 4th place. In United States, New York has the highest number of confirmed cases, followed by New Jersey, followed by California, followed by Michigan, followed by Florida, followed by Massachusetts. On March 31st, 2020, United States concluded with 189,543 confirmed cases. On April 2nd, United States has 242,366 confirmed cases, but globally, the whole world has more than 1 million people infected. The confirmed cases globally is 1,012,042 confirmed cases. New York has 92,506 confirmed cases, almost 100,000. United States is far above on top of all other countries in the world. United States has more than 242,000 confirmed cases, followed by Italy, and then followed by Spain. And first time, Germany is on top of mainland China, and mainland China has dropped to the 5th place. So, on April 2nd, 2020, United States concluded with 244,912 confirmed cases. On April 4th, United States has more than 276,000 confirmed cases, almost 300,000. Globally, the whole world has more than 1,096,000 confirmed cases. New York has more than 100,000 confirmed cases, is 102,987 confirmed cases. Globally, United States is still far above on top of all other countries in the world, followed by Italy, followed by Spain, and then Germany, and then mainland China. On April 4th, United States concluded with more than 300,000 confirmed cases. The number is 311,533 confirmed cases. On April 8, 2020, United States has more than 431 confirmed cases. Globally, the whole world has more than 1.5 million people are infected. The number is 1,513,178. There are two other things that require everybody's attention. First of all, United States has more than 14,000 people died, almost 15,000. Secondly, in the world, there are more than 88,000 people died, almost 100,000 people. In United States, New York has more than 151,000 confirmed cases and 6,268 deaths. Globally, United States still has the highest number of confirmed cases in the world, followed by Spain, and then Italy, and then Germany, and then France. France on top of mainland China, and mainland China has dropped to the 6th place in the world. On April 8, 2020, United States concluded with 434,780 confirmed cases and total 14,768 deaths. Maryland enacts stay-at-home order on March 30, 2020. Now many states, even federal government, ask people to stay home and also ask people to wear masks when they go out and keep social distance. On Wednesday, April 1st, 2020, the Empire State Building will be light red with a siren in the mast paying respect to heroic COVID-19 emergency workers. Afterwards, I'm going to show you several pictures and reports from different media. The light show is meant to resemble both a heartbeat and an emergency siren. The Landmark's Twitter account says the display will remain through the COVID-19 battle. Okay, that's it for today, everybody. Thanks for watching, and please stay safe and keep healthy. Stay home, wear masks, and keep social distance. Thank you, everyone. Bye-bye.